Hello, and welcome to this workshop on the serious health consequences of belly fat and how to permanently get rid of it. I tried to do this live yesterday, but I had some tech issues and I don't really know what happened because one person got in, but then other people told me they tried to get in, but they couldn't get in, and I didn't see them trying to get in. So I'm not really sure what happened. But, anyways, the one person who did get in, I knew. And so we decided that instead of me talking at her for 60 minutes about belly fat, we just chatted about her stuff going on and just had a nice one-on-one. And then we decided that it would be better if I just recorded this on my own time and sent her out the replay and sent all of you guys out the replay. I know you guys are busy, and I think it's easier. It's easier for me. I have a really hard time getting to live workshops and live trainings too. I much prefer the replays. I can listen to it on my own time, when I'm driving, when I'm working out, stuff like that. So here we are. This is the recording of the workshop that I promised. And we are talking the serious health consequences of belly fat and how to permanently get rid of it. Okay. Uh, and this isn't just about the aesthetics of belly fat. And I know you guys are frustrated with belly fat. I've worked with hundreds and thousands of people at this point in my career. I've been doing this for 20 years. I've reviewed hundreds of intakes of women telling me their biggest frustrations and what they've tried and what their goals are. And belly fat comes up over and over and over again. It's like this frustrating, stubborn area that women can't seem to make any headway on. It's really frustrating. And the thing I want to focus on today is that yes, it's frustrating, and yes, it's an aesthetic issue. We don't like how it looks. We don't like how it feels. But as we get older and older and the years go by, that belly fat is actually linked to serious health risks that go far beyond what you look like. Okay. And so we're really going to focus on that. And specifically, we're talking about the deep visceral fat. And what we know in the medical community is that there is a very strong correlation between increasing belly fat and insulin resistance, chronic inflammation, hormone imbalances, and then prediabetes, type 2 diabetes, cardiovascular diseases, and certain cancers. And here, the hard truth that I just want to dive into right away is that traditional weight loss methods won't work to get rid of it. Okay. Eating less and exercising more can actually make it worse. And many of you probably know that, right? I've tried these diets. I lost some weight. I didn't lose belly fat. And then I gained it all back. I lost some weight and I gained it all back. And my midsection keeps getting bigger. And those are signs that you've got you've got the metabolic dysfunction. And every time you go on one of these restrictive diets or you try to just willpower your way through long workouts, tons of marathons, we're actually making the problem worse. It's not belly fat that we're talking about today. The deep visceral fat is not just about calories. No matter what they say on the internet, it's not about calories in, calories out when it comes to deep visceral fat. Okay. It's about hormones, insulin resistance, inflammation, and metabolic dysfunction. Belly fat that won't budge despite dieting, cutting, restricting, exercising more is a sign of underlying metabolic and hormonal and systemic inflammation issues. Okay. Most notably, insulin resistance, elevated cortisol levels. Okay. And so these issues, along with age-related hormone changes, can make visceral belly fat particularly stubborn to lose. And if left unchecked, this visceral fat increases your risk of serious health issues. Type 2 diabetes is the big one. Heart disease is the big one. And certain cancers, those are big. And I used to work in the hospital. Okay. I spent 10 years working on the front lines in healthcare. I worked everywhere. I was a casual a lot of my career on the hospital, and I worked in rehab as well. But everyone in the hospital, when I remember reviewing charts before seeing clients, it was diabetes type 2, obesity, coronary artery disease, hypertension, right? Everyone had that medical history. And I remember one of my one of my first patients, you would call them when we worked back in the hospital. I was working on a surgical ward, and it was someone post-op day one from a below-knee amputation secondary to diabetes, unmanaged diabetes. And it was my job to go in, get this person up for the first time after losing their leg as a result of unmanaged diabetes. Like, diabetes is not a joke. And I think it's talked about a lot. And I think if you haven't seen the long-term consequences of diabetes, I've also worked in renal care as well on the renal ward. Kidney shut down eventually. Like, with diabetes, there's so many consequences. And the first sign that your body is metabolically struggling and headed towards diabetes is belly fat that won't budge, that keeps getting bigger. And so that's what we really are talking about here today. Today, we're going to talk about why belly fat is more than just an aesthetic concern. We're going to talk about why women in perimenopause are at higher risk. We're going to talk simple ways to assess if this is a problem for you, common mistakes women make trying to get rid of it, why they don't work. And I really want you to understand this so you don't do these things, because they're making it worse. And like I said, diabetes and metabolic dysfunction is really no joke. And it's, right now, belly fat's just an aesthetic problem that you don't like. But in 10, 15, 20 years, when it progresses and we keep using ineffective diet strategies and it progresses on to diabetes, it's a serious problem. Okay. And I don't want that for you guys, because it is completely unnecessary when you take care of your body strategically and intentionally. Okay. And then we're going to talk, of course, most importantly, how to permanently get rid of this belly fat by working with your hormones, reversing insulin resistance, and priming metabolic function using my metabolic rehab method. Okay. So let's dive in.